All right, well, welcome everyone. Thank you for joining us for this Altman Health Talk, Pregnancy and Postpartum Pelvic Floor Health. We have Darla Schwab here, physical therapist. Just a little bit about Darla. She is a physical therapist who specializes in the care of pelvic floor dysfunction in pregnancy and postpartum conditions. She's located at our Altman North location and is accepting new patients. So I will turn it over to you, Darla. So welcome this evening.
Hello. So what we're going to talk about tonight is a little bit about pregnancy and postpartum pelvic floor health, a lot of things that we see patients coming in for that they really didn't know that we were able to help with. So we're hoping to improve the knowledge of the community as to what we can help with, so that way people aren't suffering needlessly, and that they know that there's somewhere that they can come for help. So we're good. So it is important to realize we are just a piece of the puzzle. We are not attempting to replace the care of your OBGYN in any way or substitute care. So we are an additional team member in the care of pelvic conditions. And it's still very important to maintain regular health screenings with those professionals. And we work very closely with your physician as part of a multidisciplinary team to ensure that the patients are safe and that we're returning function to where you want to be. So often the question that we hear is, you mean that there's therapy for this? In the United States, we are not as far advanced as some other countries as to providing care for our postpartum moms. It's actually the standard of care in the UK for women after they have a child to have at least 6 to 8 pelvic floor PT visits after every delivery. So some of the stuff that we'll talk about in here is us working toward those types of goals that are seen in places like the UK to help improve our moms postpartum. So conditions during pregnancy that we may see as physical therapists here is any kind of discomfort during pregnancy that's enough that prohibits you from functioning as normal. Some discomfort during pregnancy is obviously uncommon as the body is stretching and growing a new human being. But we are trained to help to reduce many of these symptoms, including but not limited to pelvic pain or heaviness that some moms may feel, pubic symphysis pain or sacroiliac or SI joint pain. These can happen in either the back, lower back, or in the front of the pubic bone. These are largely due to the joints spreading out as the baby progresses in growth and the mother gets larger as the pregnancy goes on. It can be worse in conditions where moms may have had pregnancies close together. So we can also help with sciatic or low back pain that stems a lot of times from the pelvis. And we can work to help to maintain activity during pregnancy. Studies have shown that maintaining activity during pregnancy results in more favorable birth outcomes. So it's important to keep people moving. So we don't want moms stuck on the couch or not being able to participate in activity because they're in pain. So these are different conditions that we can address during pregnancy. So postpartum conditions, these are what we see more of. Not that we can't help with the pregnancy population, but typically we're known more for the postpartum population. So we'll go through some of the things that we can do to help. So ACOG, or the American College of Obstetrics and Gynecology, actually released new guidelines in 2018 regarding the 4th trimester. And this was largely moving forward for our communities and where they want us to try to move toward. So they acknowledge the challenges that women postpartum have, including pain, decreased sexuality, stress, and stress incontinence. So they also encourage individualized and women-centered postpartum care, specifically toward the needs that we address above, the challenges like pain, decreased sexuality, and stress incontinence. They also want to work toward optimizing care during pregnancy, looking at education as to what those mothers may experience postpartum before the mother delivers. So knowing that, hey, you may experience some of these symptoms after you have a child, but guess what? There's help available. So it does help a lot of moms at least know that, hey, it might happen, but there's something that we can do to fix it. And postpartum recovery following birth was one of the specific pillars and domains that they looked at. And pelvic floor therapy is actually great and aimed at being able to directly take care of things like painful intercourse, perineal or cesarean incisional pain, urinary fecal incontinence, resuming normal physical activity, and getting back to a healthy weight. So those guidelines were pretty huge and supported what we already knew, that pelvic floor therapy could help these moms move forward, but having ACOG behind us is even more substantial. So we'll go through some of those conditions that we talked about there with the ACOG guidelines. Incontinence, it's common, but it's not normal. Everybody laughs about, after you have a child, you have to cross your legs because you might pee. Yes, 60% of postpartum women suffer from stress urinary incontinence. However, I tell people all the time, you don't wake up one morning when you're 50 with organs falling out and full-blown incontinence to the point where you need things like pads on a regular basis. It starts postpartum. Once you're postpartum, you stay postpartum if you didn't do something about it. And this can be urinary or fecal incontinence, or both, following delivery. So perineal tearing, or the tearing that can happen with a vaginal delivery, depending on the severity of the tear, if it's a 3rd or 4th degree tear, can actually involve muscle tissue, which obviously can place you at risk for incontinence. Just the weight of the baby puts stress and strain on those muscles, and they don't just bounce back. And a lot of times it takes multiple deliveries before people start to notice a lot of problems, which is why greater than 2 vaginal deliveries greatly increases your likelihood of dealing with incontinence postpartum. And as I stated earlier, poor pelvic floor strength leads to increased chance of prolapse in the future. So we want to address this when it happens in a young, healthy female before we're trying to deal with this 15, 20 plus years down the road. Not that we can't make improvement, but it's much easier to make improvement between children than if we try to fix it after the fact. So incontinence is not solely fixed just by doing your Kegels. 30% of women aren't properly able to isolate those pelvic floor muscles in the first place. And there's 2 different kinds of fibers within the pelvic floor muscles. If you're not addressing the different types of fibers based on that woman's need, you're not going to see the improvement that you're going to see. And if you had tearing, you can actually increase pain and make your symptoms worse. So it's important to at least get evaluated, whether you get evaluated by your OBGYN or whether they send you over for us to work on some strengthening and make sure that your strength is appropriate. You don't always, Kegels aren't the end all be all that a lot of people think that they are. So did we lose? Okay, there we go. So perineal tearing or tearing with delivery, trauma, and pelvic pain are all things that are part of childbirth times that can cause problems, and we can deal with pelvic floor physical therapy. So with a vaginal delivery, any kind of perineal tearing can result in pain. Depending on how severe that tearing is, it can be pain in sitting, pain with activity, or just pain with intercourse, depending on how severe it is. But again, the muscle tissue may have been impacted depending on how severe that tear was. Muscles within the pelvic floor tend to stay tight once they're torn or and once they have any kind of trauma. So they don't always go back to a relaxed state, and that's where people will deal with some chronic pain. So some obstetrical trauma that people can see that will result in perineal pain or pelvic pain if they were pushing for a prolonged period of time. If the baby was occiput posterior presentation, meaning like sunny side up, the baby came head first, face up instead of face down, it can cause an increased second stage of labor, increased time that you're pushing to deliver that baby. If you sustain something like a coccyx fracture, or if you needed forceps for delivery, that can all result in increased tension and pelvic floor pain, which is treatable. But a lot of people don't know that those sorts of things can then result in some increased pain following. So painful intercourse postpartum is something that is extremely common and is not talked about. 64% of women report sexual dysfunction a year following childbirth. That's huge. And it often goes unmentioned because at that 6-week postpartum visit, most people have not had intercourse at that point in time. So they don't know that it's painful. And if they don't seek out an additional OB visit after that to have that addressed, they suffer in silence, which is unfortunate because it's not hard to treat, and we can typically get it treated pretty quick, but it's not something that's talked about. It's have a glass of wine and use some lube and you'll be fine, is what a lot of people are told. And unfortunately, they still continue to suffer in pain, and we can end up with further pelvic conditions as a result of this. So it's something that we can help with. It's learning how to relax these muscles and getting any tight spots gone, which is easily done with us here at Altman. But there's multiple implications. There's multiple implications with the painful intercourse. That also leads to relationship issues. It leads to increased postpartum depression on top of women who already feel like they don't have their bodies the way that they should, and can cause those relationship issues. So cesarean scar management, anytime you have a surgical incision in the body, there is a disruption of the connective tissues below it. I often use the example, if you have a multi-level cake in front of you with icing between every layer, you cut a piece of cake out. Doesn't matter how good you are at putting that piece back, all of those layers of icing are not going back together the way that they were when you first cut that piece of cake. So those differences in layers can cause adhesions, or can cause things to kind of stick together or not move as well as what they should, which then can result in other pain. So things like low back pain, pelvic pain, pain with intercourse. So it's important to start to learn how to move a scar. And a lot of women are never told that they should move their scar. We don't want to tell you that at the hospital because we don't want you messing with a fresh incision. And we don't want to mess or move that incision until you're at least 6 weeks post-op, possibly even toward that 8-week mark. So that's where we come in, because normally by then you've already been cleared by your OB, to help to teach you how to move that scar. A lot of women are very sensitive over that cesarean scar. And there's several techniques that you can use to help to reduce the sensitivity of that area easily at home. So that's something that we help to teach our moms how to do as soon as it's safe to do so and that wound is closed, so that way we can prohibit any issues down the road. So diastasis recti, this is a separation of the abdominal wall that's commonly caused by pregnancy. So this is a vertical separation of the transverse abdominis, and this can result in several symptoms, including low back pain, excessive abdominal bloating that gets worse as the day goes on, constipation, and even abdominal discomfort with touch. A lot of these moms having a child on their lap will be uncomfortable, especially if they go to elbow them. A lot of moms who have what they call the mommy pouch or the mommy belly that just can't seem to go away, it can be from this. The deep muscles of the transverse abdominis, it's the deepest muscle of your core. That's not worked by things like doing crunches. It can actually make this worse. This is the deepest muscle that works as a corset. So if you don't strengthen up that muscle, you're not going to see the improvement that you want to see. And it's specific exercises to do this. So a lot of women have a hard time learning how to isolate this muscle. It's not hard to use, just needs a little bit of guidance to find it properly and to train it the right way. So this condition is not purely cosmetic. It's not just something that doesn't look the way that you want it to do. Because it impacts the ability for your body to maintain intra-abdominal pressure in your abdomen, actually places you at increased risk for things like hernia, pelvic organ prolapse, incontinence, and chronic low back pain. We see this a lot with moms who they might not know that they even have a separation in their abdomen, but they have chronic low back pain that doesn't go away. And most definitely, it a lot of times has something to do with diastasis recti, especially if they've had more than one child. It is treated with simple exercises. We teach you the basics here. We have you work on most of it at home. But we also go over things like proper breathing, not holding your breath when you're lifting your child, improved postural changes, and then we do regular office follow-ups to progress your program appropriately, modify it as you need, and get you the improvement that you want to see. And normally we have really good success with this. We're able to close it normally within 3 months or less, typically in 5 to 6 visits. And this again is also very common. 60% of women 6 weeks postpartum have this, and 33% continue to have it 1 year postpartum. That's significant because most women, if they're going to have multiple children, they're spacing them about a year apart between pregnancies. So if we don't correct this by the time that mom is 1 year postpartum and they're having the next child, now we're already starting off behind the 8 ball. So it's not hard to fix, but it's something that should be addressed in our postpartum moms. Low back pain, 77% of women have low back pain that interferes with daily lives postpartum, 12 months postpartum, which is a very large percentage point. And low back pain is directly correlated with stress incontinence. 72% of people who have low back pain have stress incontinence. And again, it correlates with the Diastasis Recti. And that all has to do with the fact that the abdominal cavity is almost like a pop can. You have the diaphragm at the top, you have the pelvic floor at the bottom, and you have the abdominal muscles that wrap around the sides. You have to make sure that all sides of that can are properly strong to be able to maintain any of the forces that are going through there. So in that situation, the pelvic floor is the bottom of that can, the core is the front of that can. And if you don't have appropriate strength on all sides of those cans, you end up with things like stress incontinence and low back pain. So it's something that's there. A lot of people think that it's just a nuisance, but it's actually telling us that there's a lot more going on. So what to expect from pelvic floor PT? Most people have never even heard of it, let alone know what to expect. So we'll talk a little bit about what to expect with us. So our pelvic floor PT program specializes just in pelvic patients. So that's the patients that we are seeing throughout our day. There are currently 2 of us here at North. Clients are seen in private rooms outside of the main therapy gym. We're on the 2nd floor of this building. We're the only ones up here. Orthopedics is now up here with us as well, but we're separate. We will do a comprehensive history to find out what issues we may be dealing with, as well as a physical examination based on your unique needs and what you're coming to see us to treat. We are trained in vaginal and rectal assessments. That's not saying that that would be something that you would need to go through, but it could be something that your therapist will talk to you about if we feel that that is necessary to address the concerns that you're coming to us with. We proceed in that manner, not always on that first visit either. We don't use a speculum. There are no stirrups. It's a single finger examination. And again, that's based on patient preference and not always completed the first visit. Office visits are typically weekly or every other week. Length of treatment in terms of weeks varies. Most of our patients are discharged in less than 3 months. And treatment times, each visit's about between 45 minutes to an hour is what you could expect for that. So treatment can include things like strengthening, depending on what you're coming for, a home stretching program, or core strengthening. And again, this is all very broad topics, but it would be specific to what your needs are. Our care plans are largely home-based because we understand the difficulty of trying to get to therapy visits with young children, especially if you're trying to work or balance other children at home. It is never too late to address any kind of pelvic floor dysfunction. A lot of times we'll hear, well, it's been 20 years since I've had a kid. Can you help me? Absolutely. It's not saying that we can't help someone that has had children multiple years ago, but this is something that we'd like to see more pregnant, postpartum, newly postpartum women seeking access for, so we can prevent some of the problems down the road. Currently, we require a referral to be seen here at Altman. Any physician, OBGYN, primary care physician, nurse, midwife, chiropractor can refer for pelvic floor physical therapy. So just give them a call, get contacted, and then they can get your referral sent over for us to get started. So I did list our contact information. The Altman North PT location is located on Whipple with the phone number there provided. And then I listed my email there. If there are any questions that you would like to ask, you can feel free to do so. So I hope this was helpful to give you an idea of what we can address with our pelvic floor program here for pregnancy and postpartum women, and hope to help some women soon.